Welcome back. Thanks for staying with us. The Department of Health has raised concerns about the rise of deaths among tuberculosis patients. In a meeting focused on the infectious disease over the weekend, Health Minister Dr Joe Phaahla said that 300,000 people are diagnosed with TB annually. He also added that in 2021, the World Health Organization estimated that 56,000 people in South Africa had died from TB. For more on this, we're now joined by Chief Director, TB Control and Management at the National Department of Health, Professor Norbert Ndjeka, and he joins us via our video link. Professor, thank you so much for joining us here on the late edition. 56,000 people died in 2021 from TB in the country. This is very alarming.
Yes, indeed. 56,000 is almost like a Boeing 737 or Airbus crashing every day and killing all its passengers. It is a problem. It is a big problem. And Statistics South Africa has been also saying that TB remains the leading cause of death in South Africa.
Why does it seem as if, we are not winning in terms of this battle with TB? Because, your stats even show that at least 300,000 people in South Africa are diagnosed with TB. And one would say, with the amount of work being done by the health department, it shouldn't be sitting at this number.
Yeah, you're right. 300,000 is a lot for a country of 60 million people. But 10, 12 years ago, we were sitting at more than 600,000 a year. So the TB incidence is coming down. It's been coming down. It's come down by almost 50% over the last 7-8 years. But of course, 300,000 is still a lot. It's still a big number.
Where does it seem, perhaps, where are we going wrong? Or where does it seem as if we're not winning the battle here? I know that you say that the department has managed to at least halve the amount of infections we see on a yearly basis in South Africa. But one would say that it seems as if we're still trying to find it very difficult to get it right here. So where are we going wrong in terms of trying to curb TB in the country?
Yeah, thank you for the question. That's very important. So what we've not been doing right really is to find all people with TB. We still have a gap of between the estimated number and the number. What we say, we have 300,000 estimated. Last year we only treated 224,000, and the remaining the gap between 224,000 and 300,000 were not found. Now, those are the people that continue TB transmission because they are not diagnosed and they continue to transmit TB. That's really the tragedy right there, because when you find someone with TB and you treat, you render them non-infectious. They may not infect the disease, they may not infect other people, but when the people remain undiagnosed, they transmit disease in the communities.
And I was about to come to that and say that are actually people in South Africa aware perhaps of the symptoms that they may carry, and do they even go to their nearest clinics or hospitals to actually check it out, or do they simply just hope for the best and think it will go away?
So the people are aware, not fully aware, because we still have a lot of people who are not going to our facilities. People know if you could be having TB, you go for checkup. But the challenge is a lot of people with TB are asymptomatic. They don't have symptoms. That is why what we are doing is to test people in high-risk groups regardless of symptoms. If you are living with HIV, you should be tested for TB regardless of symptoms once a year. And of course, you also get tested if you are coughing. If you are a close contact of somebody who has TB confirmed by laboratory, you should also be tested regardless of symptoms. And also when you have just completed treatment, the year following treatment completion, you should get treated regardless of symptoms. So that's, by so doing, we've been able to find more, but it's still work in progress.
And just a bit earlier on, you spoke about that you see lesser numbers from the stats that you have as the health department. And one would say that a year or two ago in South Africa and, the world over was struggling with COVID-19. Do you think perhaps that, the disruption in our lives and caused by COVID-19 has resulted in fewer people trying to get treated for TB?
Yes, during the year 2020 and even 2021, we had seen a massive decrease in terms of people seeking TB tests and even TB treatment. We saw a decrease evaluated to around 20%. But last year, we've really tried to push during the year 2022 to try and talk to people, market TB testing, and we saw the test increased. We had tested like 600,000 extra tests compared to previous 2-3 years, which helped to find 224,000 in 2022. But if you look a year back or 2 years back, we have 180,000 people only. So we are recovering definitely from the impact of COVID, but we still need to do more effort in terms of linkage to care. We need to link everybody diagnosed with TB to care, but they must be on treatment and finish treatment.
Yeah, and when you talk about finishing treatment, and when you speak of tuberculosis, it's often the treatment that always comes into play. And I understand that many strides have been made in South Africa to give people shorter treatments. So surely this should be encouraging to many South Africans.
Definitely. We're able to now treat MDR TB patients for 6 months. We're moving towards 4 months regimen for children early next year, and hopefully people with drug susceptible TB adult for 4 months in the near future. But the MDR one is a critical, is a massive improvement, because we used to treat that group of patients for 2 years, then we moved to 18 months and then 9 months. Now 6 months is really a big revolution. But I think we need to continue to work very hard to shorten this to even 2 months before 2030.
All right, and perhaps maybe just if you could give some advice to South Africans, perhaps those who did not complete their tuberculosis treatment, and to various other South Africans to get treated or, tested for tuberculosis.
So my advice really is that if you live with someone who's coughing, you need to go to the clinic also. You might be both having TB. If that person has been told that they have tuberculosis, you need to be tested even if you don't have any symptoms. When you start treatment, you need to finish treatment. It is very important to finish treatment, because if you leave treatment, you might develop resistance, and it will be difficult to treat you. First time to get TB treatment is the best chance to be cured. If you come back second time, third time, things are a bit complicated. But if you have stopped treatment, please go back, get your treatment back until you finish. It is very dangerous to stay with unfinished TB treatment. You could develop a worse form of resistance, which can be difficult for you, but also a big problem for your family or people you're working with.
All right, Professor, thank you so much for your time. That is Professor Norbert Ndjeka. He is from the National Health Department and he's the Chief Director for TB Control and Management.